I'm here today with Dr. Dean Karahalios, a fellowship-trained spine surgeon practicing on the North Shore of Chicago as part of North Shore University Health System. Dr. Karahalios, where are your offices and where do you perform your surgeries?
My outpatient offices currently are at Skokie and in Vernon Hills, and most of my surgeries are performed at Evanston Hospital, and I also perform surgeries at other hospitals within the North Shore system, including Skokie, Glenbrook Hospital, and Highland Park Hospital.
Great, so it really sounds like your offices are convenient to both patients in the city of Chicago as well as on the North Shore. We read in your bio that you are a fellowship-trained spine surgeon. Can you tell us a little bit about what that means?
Sure. Fellowship is training that's above and beyond the normal routine residency that a surgeon would go through in training to be a neurosurgeon. And what it means is that I can typically do procedures that are of a higher level of complexity in my subspecialty, specifically spine. Most, if not all, neurosurgeons will do routine spine cases, including things like microdiscectomies, laminectomies, cervical procedures. I do those as well, but also can do the more complicated operations too, requiring spinal reconstruction, instrumentation, and higher level of complexity cases that required special techniques to deal with spinal infections. I also have some expertise and training in dealing with spinal tumors non-operatively using radiosurgery techniques.
Great, so you've given us some insight already into the types of cases that you frequently perform. Are there some newer types of procedures that you find yourself doing frequently?
Yes, there's a movement in medicine in general, and certainly our specialty is no different, to try and do procedures in a more minimally invasive fashion. And there are a number of techniques in spine that lend themselves well to minimally invasive procedures, and we also perform those as well. We can essentially accomplish the same thing we can with an open procedure through a very small incision and with minimal tissue disruption. And not only small cases like discectomies, but larger cases as well, such as fusions.
Great, and why don't you just tell us a little bit about your perspective on the cervical artificial disc?
Well, that's another area that has really come about. It's a very interesting new technology here in the United States. It's technology that's really been used worldwide for about 20 years, but only recently, over the last 2 or 3 years, has it been available in the United States. And what this essentially allows us to do is perform a discectomy when necessary to relieve pressure on a nerve or the spinal cord. And instead of doing a fusion procedure, what we do is insert a device into the disc space to maintain motion, an artificial disc. And it's been shown that there are advantages over fusion in terms of patient recovery, less pain, and we also feel that there's benefit in maintaining motion because down the road in the future it may prevent future operations.
That's really exciting stuff. I think to finish up, it would be great if you could tell us a little bit about why you became a neurosurgeon in the first place, and maybe just a little bit about your personal or family life.
I think that the most likely reason for me to get into the field of neurosurgery as a specialty in medicine, specifically spine, is because I'm sort of a tinker. I've always been one that likes to work with my hands in the tool shop and craft things, and my specialty in spine lets me do that. So I have the best of both worlds. I can combine my hobby with my job, and that is very gratifying. In terms of my life in general, I find myself with fewer and fewer hobbies as I get older, and as the demands of being in a busy practice come to bear. But I still have time to spend with my family, my young girls, and we go to all the sporting events that every other parent goes to in support of your children, and have a lot of fun doing that. And we ride horses. That's one of our pastime activities, and we have a good time doing that. So it's a challenge of trying to find as much time as you'd like to spend with your family when you are trying to balance your career and your profession and the lives of patients who you consider to be part of your family. And they need your time as well. So it becomes a challenge. But for now, I think I'm doing a reasonably good job balancing all that.
Absolutely. Well, thank you very much. And
Sure.
I know we look forward to future discussions about such interesting topics as the artificial disc or spinal radiosurgery, some of those things that I know you spend a big part of your practice dealing with.